So guys, imagine a few months old baby was healthy at birth, but then we observed some changes, like they were unable to sit and crawl, and by the age of 1, we also observed that they were having problems with breathing and swallowing food. Well, this baby or this patient might be suffering from Tay-Sachs disease. And you must be wondering, how did we get to this conclusion? How did we conclude that this patient is suffering from Tay-Sachs disease? Well, this is exactly what we'll be covering in this lecture. So let's dive deep into this topic and see how do we diagnose this patient, what goes on at the molecular level in this patient, and how to treat and manage a patient suffering from Tay-Sachs disease. So first of all, the question arises, what is Tay-Sachs disease? Well, remember that it is one of the rare neurodegenerative disorders in which there is an accumulation of a certain lipid in your brain and nerve cells. Now, this lipid is termed as GM2 ganglioside. Now, this unusual accumulation is the culprit that compromises the central nervous system, and so the baby or the patient is unable to do normal things like sitting and crawling, or breathing, and even swallowing food. Now you must be thinking, what causes this accumulation of lipids in the cells? Is there anything missing or defective in the patient? Well, the answer is that these patients lack a certain enzyme which is present in the lysosome of the brain cells. Now, this enzyme is called hexosaminidase A or HEX-A enzyme. The absence or lack of this enzyme will cause the lipids, which were the GM2 ganglioside lipids, to build up inside the lysosomes. And as a result, the cells of the CNS will eventually degenerate and die. And additionally, the accumulation of these lipids also provokes an inflammatory response and may cause the ultimate destruction of CNS cells. Now remember that Tay-Sachs is a genetic disease. It means that there is a gene mutation on chromosome number 15, specifically in the gene that encodes for the lysosomal enzyme, which was hexosaminidase or HEX-A. Now, because of the features of this disease, we can call it by many nicknames, like HEX-A enzyme deficiency. We may call it a lysosomal storage disease, and we can also call it GM2 gangliosidosis, because accumulation of these lipids occurs in the CNS cells. And Tay-Sachs is actually a rare hereditary disease. Now, hereditary means that it passes from parents to offsprings in an autosomal recessive pattern. You must remember that the autosomal recessive pattern is in which you have 2 copies of an abnormal gene, one from each parent. And this is how the disease is transferred to the kids or the children. Now, in other cases, if one abnormal gene is inherited, the child will not suffer and will only be called a carrier, as you can see in this diagram. Now, the Center for Jewish Genetics actually tells us that almost 1 in 30 people that are carriers of Tay-Sachs are among the Ashkenazi Jews community. So, what did we learn today? We learned that Tay-Sachs is a rare neurodegenerative genetic disorder, and it is actually transferred via an autosomal recessive pattern. And what happens in it? Basically, there's an accumulation of lipids in the brain and neuronal cells that eventually causes them to degenerate and die. And so the patient is unable to, or the little baby is unable to even do mundane tasks like sitting, crawling. They even have difficulty in breathing and even swallowing food. So in the coming sections or in the next sections, let's go into the details of the different types of Tay-Sachs, how to actually diagnose this disease, and what measures are taken to manage such a patient. So stay tuned to sqadia.com.